Hi, this is Brian Kim. I'm going to share with you this case of a patient who has a very dense cataract, and you're going to see double chop, cross chop mechanical fracturing techniques and ways I'm able to disassemble the lens just using pure mechanical fracturing forces without ultrasonic energy. And I want to highlight that I'm going to have some bubbles on the corneal endothelium, and this is an excellent marker to determine if you're staying away from the cornea when you're doing your phaco, which will hopefully lead to clearer corneas. So I'm using a cotton tip to help center the eye, and then I'm using a corneal marker to help me center and size my rhexis. And I'm turning the eye with the cotton tip downward, and then I'm using my paracentesis blade to make an incision superiorly, which is on the right side here in this left eye, turning the eye upward with the cotton tip, and then entering with my paracentesis on the left side. I'm making sure I'm flat to the iris plane so I have a nice corneal shelf, which will allow me to have a self-sealing corneal incision. I'm injecting some intracameral lidocaine and then some dispersive viscoelastic, and I'm filling the eye and using the cannula to control the eye. I'm going to do my triplanar corneal incision, make a vertical groove, place the blade into the deep part of the groove, turn the eye away from me using the cannula, tunnel through the cornea, turn the eye toward me with the cannula and enter. That's the triplanar corneal incision. I'm using my forceps with the puncture style technique for my rhexis. I'm going to puncture, and in this case the rhexis went a little bit to the left, the flap, so I just go ahead and follow that flap, grab the flap on the right side going around counterclockwise, and I'm grabbing and re-grabbing, trying to make sure I stay within the confines of the corneal mark that I made earlier. And then that finishes off the rhexis. I burp some viscoelastic out of the eye, and this is the capsular fornix hydrodissection technique. I place a cannula underneath the rhexis edge contra-incisionally, point the tip down, you get a nice fluid wave, decompress on the left side, and then turn the tip to the right, pointing down, and you can see the lens spins quite nicely. Here I'm trying to achieve a little bit of hydrodelineation, which will help facilitate any separation between the endonucleus and the epinucleus. I'm irrigating the surface of the cornea, lift the incision with a chopper, go in with irrigation off to minimize Descemet's trauma. In this case, there's a lot of bubbles that came out, and the bubbles will simply highlight how well I'm able to protect the corneal endothelium and making sure I don't remove any viscoelastic during my maneuver. So I place the chopper out, place the phaco tip vertically sub-incisionally, bring both instruments together, and this crushes the lens in half. That's a double chop. Place the chopper around the contralateral equator and pull it centrally against the phaco tip. That's the cross chop. Use a little vacuum to pull the first quadrant up, get the chopper around the lens piece, and then crushing it between the chopper and the phaco tip, and then using mechanical fracturing forces to sandwich the lens pieces into smaller pieces. Once the pieces are small enough, I'm using some ultrasonic energy and vacuum to remove the lens pieces. Using a little vacuum to try to tease that piece up, it's not really coming up. So I'm going to place the chopper around the lens piece first, and then I'm able to grab it with the vacuum, pull it up, and then crush it into smaller bite-sized pieces, and then emulsify the lens pieces. This is a pretty dense cataract, and so I just want to show this systematic disassembly of this lens. I place the chopper around the second quadrant, pulling it centrally, crushing it against the phaco tip, and then using lateral forces to separate the fragments, pulling it up with high vacuum, and then crushing it and sandwiching it again and chopping it between the chopper and the phaco tip, and then here mashing it into smaller pieces between the chopper and the phaco tip. When they're small enough, I begin to emulsify the lens pieces. And it all starts with placing the chopper around the lens piece so that I have really excellent control. And when you're not sure you're underneath the rhexis edge, you have to start over if you're really not confident. So I'm lifting it up, and then I crush it against the phaco tip, and then do a little bit more lateral separation of the fragments, and then pulling them up with high vacuum, crushing it between the chopper and the phaco tip, and then emulsifying the lens pieces. So you can see there's some deeper adhesions. Because this is a dense lens, there are some leathery adhesions posteriorly. You just have to take your time and just separate them little by little using the chopper and phaco tip. So I turn the lens in front of me. I still have a little bit of that remnant of the second quadrant. Place the chopper around the lens piece, place the phaco tip deep in the bag, pulling it centrally, crushing it against the phaco tip, and then using lateral separation, making sure I'm all the way through and through separating it. I'm going back to that third and second quadrant remnant, place the chopper around the lens piece, placing the phaco tip vertically again, and crushing the lens piece. Again, all mechanical fracturing forces without phaco during the chopping maneuvers. Once the pieces are small enough, I go ahead and emulsify the lens piece using a little bit of ultrasonic energy as well as vacuum. So you can see that very large mass. I'm making sure I'm definitely within the bag when I place that chopper around the lens pieces, directing the pieces, and then crushing the lens piece between the chopper and the phaco tip into the deep portion of the adhesion. In that case, you saw that maneuver there. There was a deep adhesion, so I was able to use mechanical forces, again, very carefully and systematically, being able to place that phaco tip deep in the bag and crushing that deep attachment, that leathery attachment there. This is the last remnant of that second quadrant that I never removed. And place the chopper around the lens piece, crushing against the phaco tip, and then emulsifying the lens piece. All right, so this is the fourth quadrant now. I'm getting around the lens piece into the equator, hook it, and then pull it centrally against the phaco tip and crushing it and dividing that fourth quadrant. I'm getting around that fragment with a chopper, pulling it centrally, crushing it against the phaco tip, and it divides that fragment pretty nicely. And again, this is a pretty dense lens, so you have to be very controlled, systematic, make sure your movements are really minimally traumatic to the corneal endothelium. You can see the bubbles persist with all these maneuvers here. Again, I'm kind of encouraging the pieces towards me with mechanical forces, using the chopper to kind of pull pieces towards me, moving them out of the bag, hooking them out of the bag, and then crushing it and sandwiching the pieces between the chopper and the phaco tip. So you see that's the last fragment of that fourth quadrant. And again, I'm just using successive crushing forces between the chopper and the phaco tip. These are not soft fragments, so you can't just aspirate these pieces out. You have to mechanically crush the lens pieces into smaller pieces and then emulsify. Everything's in the bag plane or the iris plane, all the maneuvers, especially when I'm activating the ultrasonic energy, and that is why there's very little disruption of those bubbles on the corneal endothelium. So now all the pieces are out. I'm going to remove the epinuclear material, starting from the anterior to posterior. I take the chopper out, push BSS in, take the phaco tip out, and put the INA handpiece. I start sub-incisionally, removing the cortical material from front to back. You can see that because all the maneuvers were at the iris plane or within the bag plane, the bubbles are persisting on the corneal endothelium here, which means there's very little viscoelastic that was disrupted from the corneal endothelium. So I switch to the polish mode, and I'm polishing underneath the rexus edge to remove any lens epithelial cells. With these very dense lenses, I always feel like the bag is not really great. And so as you can see here, as I'm trying to polish the posterior capsule, it's puckering and it has that spider web appearance. This does tell me that the zonules are not great. So I go ahead and push BSS into sub-incisional capsular fornix, which was nice and clean. The cortical cleanup went actually pretty nicely. I'm pushing some cohesive viscoelastic to inflate the bag, and then I'm going to polish with the sweep on the rexus edge here. So again, you could see that the endothelium was coated very thoroughly and nicely throughout the phaco, and the viscoelastic was not disrupted with the phaco because of the techniques that I employed. So I'm going to use the diamond blade to widen my incision here. And then I'm going to inject this 3-piece acrylic intraocular lens into the capsular bag here. I'm pointing the bevel towards the left. The leading haptic's able to go in. Oh, I lost some viscoelastic when I pushed the lens in, so I pushed more cohesive to fill the bag. The haptic is parallel to the iris plane. It goes into the bag. The optic opens up. I rotate the barrel a little bit counterclockwise. I'm going to dial in the trailing haptic using the Maltzman. So again, using mechanical fracturing forces to crush the lens pieces, keeping all the maneuvers away from the cornea really enables me to maintain a nice corneal endothelial protection with that buffer of viscoelastic. So once the lens in, I'm polishing underneath the rexus edge. I'm turning the haptics here and making sure the lens is nice and loose. Trying to get the haptics to center nicely over my rexus here. And I go in underneath the lens because there's some fine lens material between the lens and the capsule. And then I switch to the visco mode, remove all the viscoelastic from the anterior chamber, and then I'll hydrate my incision. So again, to highlight, how do you know you have a good technique is if you have bubbles on the corneal endothelium at the beginning of the case and you still have bubbles on the corneal endothelium at the end of the case, that probably tells you have a very good technique that is not near the cornea. You're not getting any fluid near the cornea. You're not doing any manipulations near the cornea. And if you employ mechanical fracturing techniques, double chop, cross chop, and you efficiently utilize mechanical forces to divide and crush the lens pieces, and you use ultrasonic energy sparingly, you combine that with the fact that you're keeping all your manipulations at the iris plane or in the capsular bag plane away from the corneal endothelium, you should have consistently clear corneas postoperatively and with a happy patient. So I hope this was helpful to you, and I thank you for your attention.